I'm a surgical oncologist, board certified in many specialties: general medicine, general surgery, otorhinolaryngology, maxillofacial oncology, and plastic surgery, and of course healthcare management. But I'm not only an oncology surgeon, but I'm an educationalist and a cancer survivor. So, as you know, the Eurasian Federation of Oncology and the Eurasian Society of Head and Neck Oncology, they were founded on my initiative together with many leading specialists from all over the world. And this year we started one more organization, that is the Eurasian Cancer Foundation. So each of them have their own scope, and these organizations run independently their own projects. Educational programs are run by the Eurasian Federation of Oncology. Socially oriented activities like say cancer early detection camps, art therapy for cancer patients, psychosocial support, all these things are now being, which were already started by, most of those things were started by the Eurasian Federation of Oncology. Now these are being developed further by the Eurasian Cancer Foundation, and these organizations basically work in close coordination, and the technical staff basically support, and there are different teams for the ideological part of it. And the Eurasian Society of Head and Neck Oncology is basically a head and neck society which works under the umbrella of Eurasian Federation of Oncology for educational programs. And in terms of this particular meeting, which is happening now, this is the 4th IFHNOS World Tour, which is as the name itself says, it's happening for the 4th time. It was started in 2008, and I'm sure the others have elaborated you about that. And every time it is in a different location and a different coordinator. A coordinator is there only once in this tour. But it happened that for the 4th consecutive time, I'm a coordinator of this IFHNOS World Tour, and EAFO is the receiving organization for the Russian leg of for the Russian speaking countries. And this year, for the first time, the World Tour is starting from Moscow. So they'll be going to other destinations. And this particular meeting is unique. It's one of its kind, I would say, amongst all oncology meetings. And it has some things in common with some of our other educational programs which we do in non-head and neck oncology subjects, but for head and neck is truly unique. And we do the traveling faculty under the leadership of Dr. Jatin Shah. They give the lectures on particular topics. The local faculty and young doctors, this year for the first time among the whole 4 tours, from different cities of predominantly from Russia, are presenting cases for discussion. So the event is truly interactive. So literally nobody sleeps, and because the initial part of every session is 1 or 2 lectures, then comes the case presentations, which becomes that is a driving part of the whole program. So that is the core difference between a usual conference or any other meeting which happens on the same topic and this one devised by Dr. Shah and his team. And we are, I would say, we are more implementers, but every time we are trying to improve it with more input, more new people coming in, and more different structures, and trying to give more time for discussions. So it is indeed a very interactive thing, and the most important thing is for those young doctors who are residents and young specialists who may be already specialist consultants but who are quite young. Their experience may not be in par with experts who have, say, 15-20 years experience in the subspecialty. For them, this event is the most important event they should attend, in my understanding, as an educationalist, because coming to this event, they get to have a true interaction of how practically we should deal with particular clinical situations, and that too dealt with by the top head and neck experts in Russian speaking countries and top head and neck experts from different parts of the world, sitting together and interacting as colleagues. The topics have not changed much, but the content of course is changing, because like with new data available, they're all incorporated. So even for those who have attended all the 4 world tours, some of the slides used by the speakers are the same from the very first tour. Those are those cases where things have not changed in practice. But of course, there are a lot of new things coming up, and medicine is advancing, and that makes change. And as the speakers are all highly well selected, the best of the best, they are all renowned, world renowned experts in their subspecialty, let them be medical oncologists, radiation oncologists, or surgical oncologists, more of surgeons. Out of the 6, 4 surgeons, 1 medical oncologist, 1 radiation oncologist, but they're all world renowned experts. And everybody who comes to the meeting, who reads English literature, knows all these names in all the world 4 world tours. So it's as they have been picked from the best of the best. It will be unfair to even assess, because they are all really very good. They are so much hand picked. So that's why you can see in the hall, people came in, and it's the more or less the same numbers are sitting from morning till evening. So that itself means that the faculty is so interesting and devoted. And also you might have noticed another thing, the whole international traveling faculty, they are sitting there from morning till evening, whether they are in that session or not. So they make it a point that during this event, they spend the full working hours of the whole meeting. They are with the participants for formal and informal interactions.